Good afternoon, one and all. I welcome you to the second day of the international webinar series organized by the Department of Foods and Nutrition, Faculty of Family and Community Sciences, the Maharaja Sayajirao University of Vadodara. The theme of this year's World Breastfeeding Week celebration is Closing the Gap Breastfeeding Support for All. In line with this topic, today's webinar is on lactation management. We have Dr. Shruti Kantawala with us, who is going to talk about various aspects of lactation management and as a society how can we support lactation management. Dr. Kantawala is an assistant professor working in the Department of Foods and Nutrition. She has carried out various research studies in maternal and child health. She is also a certified lactation counselor apart from being a passionate teacher and a researcher. I welcome Dr. Kantawala and request her to share her slides and begin her talk. Thank you.
Thank you, Dr. Revati, for the kind introduction. Before I start, is my screen visible?
Yes, ma'am.
Yeah. Before I start at the outset, I would like to thank the Department of Food and Nutrition and the organizing team for always encouraging the young staff and as well as always participating in the World Breastfeeding Week celebration activities and this being one of the webinar series. Today I will be talking about the most common issues that are faced by the young mothers and as we say the theme of the today's World Breastfeeding Week 2024 is to inform, to anchor and engage and galvanize the just a second is my I have shared it full screen. Okay, is it on a full screen mode?
No, ma'am, not yet.
I will be sharing it again. Yeah. Is the presentation visible?
Yes, ma'am.
Yeah. And is it on the full screen mode?
Yes, ma'am. Now it is on the full screen.
Okay. So, going with the theme of WBW 2024, we are the today's webinar is also focusing on how can we inform the mothers and the support group and engage them and galvanize them in supporting the mother for the successful breastfeeding. So, I would start my presentation with WHO and UNICEF call statement, which says that the theme closing the gap breastfeeding support for all needs to emphasize the breastfeeding support group to get access to the trained, empathetic, respectful health advice and counseling throughout a woman's breastfeeding journey. So the breastfeeding journey is always starts with the last trimester of pregnancy and it continues till the second birthday of the child. So basically when we say 1,000 days or when we say breastfeeding, we want the mother to continue breastfeeding till the second year of the child's life. So with this statement, I will be focusing mainly on the establishment of breastfeeding, that is the initial few hours to the few days of a mother who faces the challenges in establishing their breastfeeding as a successful breastfeeding. And whom do we focus on? We are as a support group, as a family member, as a community member or a society member, we should always support and encourage the primary mothers for establishing a successful breastfeeding. We should ask the mother what are the problems or what is how is she going through during that initial phases. Many of the times we are as the yesterday's talk was on counseling. After the childbirth the focus is on the child and we miss out the mother. So primary mothers, we should focus and we should ask how is the feeling the mother goes through, because that solves all the problem that the mother is facing with the breastfeeding issues. So what to talk of and how to talk of, we will discuss today. The second is the C-section. So again in C-section, it is a common people's belief that C-section women cannot breastfeed within 1 hour. I am one of the few lucky women who have breastfeed their child in within few hours, within, or I would say within 1.5 hours of the my son's birth. So the mother can breastfeed. The clause or the caution here is we should ask the family members and the support group, the nurses, that if the mother is conscious, so if it is a lower body anesthesia and the mother is conscious, mother can breastfeed the baby within the golden hour of the birth, that is within the 1 hour of birth. And the most common problem that everyone faces is that initially not enough milk is produced. So how do we tackle about? For talking about the initiation of breastfeeding, we always say that in the government setup we have counseling done by the health functionaries, or in the private sectors the doctors, the nurses, the health staff, the nurse sisters do encourage that start breastfeeding the baby within the 1 hour of birth or as early as possible. But we for that step to happen, it is very important that mother goes for an antenatal counseling. At least during her entire pregnancy, the woman should have at least 8 contact points with their health providers, and especially more frequent in their last trimester. So when we are saying frequent visits in the last trimester, we are trying to encourage the mother and ask them what are the common problems that the woman is facing in that trimester related to the delivery or the initiation of lactation. So at times, if we make the mother aware that what you care you need to take care at the time of delivery, we ask the support members, the family members, that do inquire about how can we start or initiate breastfeeding within 1 hour. The doctors and the staffs are always there to support and guide how they can start. So it is more of creating a demand and creating an awareness that we have to ask how can we go ahead. Next is the most common problem that we face is the breast assessment, or I would say the flat nipples or the inverted nipples. So the assessment should definitely be done within the last trimester of pregnancy, because after the delivery, after the birth, mother is in pain, mother is sedated, and we are trying to establish breastfeeding. And because the poor child with the sucking reflex is trying to suck, but the child is not able to suck the areola part. So we need to have an assessment done in the last trimester of pregnancy and check whether the mother has a flat or an inverted nipple. We have to make the mother aware, make the family members aware that if this is the situation, we teach them few exercises, we teach them few methods, and we try to at least have some expulsion of the nipple, so that after the child is born we can have a successful breastfeeding. So here I would emphasize again on the point that when to counsel, the counseling session done yesterday was so effective, and we have to use it in a correct and a right time. So after the child is born, I cannot say, oh, you have a flat nipple, देखा नहीं था पहले, go get the breast pump, go get the breast nipple shield. Please, once in the last trimester, do ask the mother, how is your breast, how are the nipples. Do an assessment. The health functionaries The nurses, the sisters do an assessment. Is the nipple correct? Teach them the techniques so that even for a primary mother or for a flat and inverted nipple mothers, we can start a successful breastfeeding, taking care with these small little steps that we help us in establishing the breastfeeding. And as I last again previous in my few previous slides said, breastfeeding support initially in the hospital setup, we are asking the healthcare functionaries to help us in establishing the support. But that equally means the family members, the people around the mother, should also be there standing next to the healthcare to learn the technique and support the mother for the subsequent frequent breastfeeding. As we say that initially the milk produced is cholesterol, so definitely the mother needs the support. The mother is in a pain. The mother has just undergone the surgery. She's not able to sit, she is not able to move. So in that situation, the family members, the person whom she loves or she cares, or that person who cares about her is next to her, she feels motivated, she feels protected, and that protection and motivation helps in establishing the breastfeeding. I always say when a mother has some doubt, some fear in her subconscious mind also, that affects the breastfeeding from production as well as the ejection. So, mother should always be kept happy. That is something which is traditionally done in our Indian system. That we always keep the mother and the child happy, isolated, protecting them from the infections, and at the same time taking care, preventing them from the hustle bustle of the daily life. So we need to be around the mother, taking care of her needs as and when needed. I just want to highlight here that the slide here shows the difference between the milk produced in the initial few days and after, when we say the transitional milk is there and we have a mature breast milk production. The amount, the volume of milk produced is different, the texture, the consistency is different. We all, as a support group, as a healthcare functionaries, we know that colostrum is rich in antibodies, colostrum is in very few drops or in lesser amount, but that is our technical knowledge. We have to implement that technical knowledge into our daily practice. That means that when we say that the colostrum produced is few drops, it also means that for the initial few days, the requirement of a baby is very less. It is as less as 5 ml to 7 ml, and it increases gradually on day 2, day 3 to 30 ml. So, colostrum, which is produced in few drops, how can a mother measure that colostrum is produced? The mother will never be able to feel that the milk is produced for initial few days. Simple reason is it's in few drops and the requirement is also very less. So what is the key message here? The key message here that we are trying to highlight is the requirement is less, the production is less. So it means that we have to put the baby to the frequently to the breast, which will take care of the small needs in the initial few days of the child's life. So we need to promote or we need to encourage the mother that at least every 1 hour, 1.5 hour, put the baby to the breast. Baby will get tired or baby has a suckling reflex. So the establishment of the breastfeeding is very successful if baby is put to the breast frequently in the initial few days. So I would again urge our support staff, support groups to encourage the caretakers, because the nursing staff will come 2 hours or 3 hours, but the family members can support the mother with every 1.5 hour for initial few days so that the requirement is met. Mother feels that their milk is produced, and it takes care of all our public issues, which is like preventing them from the low birth weight, hypothermia, hypothermia, and the mortality rates. Similarly, this slide also talks of the requirement increases gradually. Still, the by the end of a month, the requirement is closer to 100 or 120, 150 ml, which is as the size of a stomach of the infant or the newborn is as big as a large medium size egg. So the requirement increases, and eventually the milk production also increases, and the requirement is taken care in the as the child progresses. So here I'm just uh, reiterating the message that initial the milk that is produced is colostrum, which is rich in protein, or which is high in protein compared to the mature milk, which is fore and hind milk. That means though it is few drops, it takes care of the initial few days requirement of a newborn, with the protein content, which is good for the child's day to day development. Because remember, the initial 1 week there would be a weight loss, the loss of the fluid which is retained in the body, there would be a fluid loss. And so common people's understanding is that weight is lost, there is not enough milk, and that leads to the thought of the mother or the family member that we should think of some other options. No, milk is produced which is sufficient for the baby, but the milk produced is colostrum. It has lactose, but it has more equal amount of proteins, which takes care of the child's requirement. So please do not start any other milk, any animal milk or formula milk for the initial 2 days, because that is where we are facing the problem. Our early initiation rate is still 40s, 45. It's simply because we are not able to establish the first 2 days of breastfeeding in the mother and the child. And for this simple reason, we know the signs that it is the colostrum which is produced lesser in quantities, but those quantities are sufficient for the baby if we put the baby to the breast frequently. So I would urge you all to recommend the mothers to put the baby to the breast frequently, 1.5 hour for initial few days till the colostrum is produced, so that it establishes the successful breastfeeding. Along with that, I'm again talking of day one. The mother is in pain, and we are asking her to sit and feed the baby. But in the initial few days, we can teach the mother the different positions, especially the lying positions, so that when she is in pain, she can successfully breastfeed the baby. Because it is always that whenever the mother is in pain, she will never ever be able to successfully breastfeed the child. So we always need to ensure, before we ask how is your child, how are you, how is your health, with a smiling face, so that the mother feels that they are concerned about her. They feel protected. They feel that she is equally given importance in this journey of her pregnancy and lactation. Because she was pampered till pregnancy, and suddenly it is the child who's taken all the limelight. But yet we are concerned about her. Is she in pain? Just support, just give a slight massage wherever she is feeling pain about. If it's a back, it's a headache, wherever she feels, give that protect, give that warm, and make her comfortable in the position in which she feels comfortable to breastfeed the baby. We should not say no, sit and then feed. If you are in pain and you want to lie down, you can lie down and feed the baby. Remember, If the position of the mother is correct, only then the position of the baby will be correct. We all have studied or have knows the proper latching and the correct latch of the baby, but for that correct latch we need to have the correct position of the baby, and for that we need to have the correct position of the mothers. I'm not going into the details of how is the correct position, but I just want to highlight here, looking at the image, if you see here, the baby is head in the right side picture, the baby's head is only tilted towards the mother, and the entire body is in a flat surface and in a back support. So eventually if the baby is sucking on the breast, within 5 or 10 minutes the baby's neck will start paining and baby will leave. So mother will feel, okay, the child has full, now I should stop feeding. And again, immediately within 1.5 hours, the baby again starts demand for breastfeeding. So is it the issue with the breast milk, or is it the issue with the position? So we need to assess the breastfeeding and check is the position is wrong. If the position of the mother is wrong, correct it. If the position of the child is wrong, correct it, and support it the better way that how they can establish a correct position. So as I said, 90% of the times whenever the woman is breastfeeding, she is leaning forward and breastfeeding the baby. So basically baby is in the lap and mother is bending forward to feed the baby. But remember, that mother might have undergone a c-section delivery, or even in a normal delivery or in a forceps delivery, she is in a pain, and we are expecting her to lean for 20 minutes, 30 minutes and feed the baby. She will not, and that affects our breastfeeding successfulness. So we have to correct her position by just giving a support to the mother and ask her to sit comfortably, and give a pillow so that the baby is raised above and mother can breastfeed. So the positioning is to be corrected here, and the mother should be sitting comfortably. If she is sitting in a chair, she can breastfeed, but her leg should not be hanging. There should be a leg support. There should be a hand support. If the mother is on a back, on say bed, then there should be a pillow behind her so that she is comfortable. She is the back, the neck is protected, supported, and her position is correct. And as I said, again, rectify the 4 steps of the baby, that the baby should in a straight line facing towards the mother, closer to the mother, and uh, like the mouth should touch the chin. These are the different positions which the mother can try after she is comfortable. She is maybe day 4, day 5, she is able to sit and sit for a longer hours and can feed the baby. So whichever position the mother is comfortable, it can be a cradle position, it can be a cross cradle, it can be a football hold. So the different techniques are there to support and guide the mothers, but it is always the mother who chooses which position she wants to feed the baby in. So we should always impart the knowledge or give the knowledge that these are the different positions. You try anyone, and if you are comfortable, continue doing that. If you are finding any difficulty, do approach us, take care of our support group, and strengthen your correct practices. Remember, I am reiterating the message here. If the mother's position is not correct, it directly is linked with the unsuccessful establishment of the breastfeeding. And if the breastfeeding establishment on day 1, day 15, or day 30th, 1 month, if the establishment is not correct, the mother starts feeling depressed, the mother starts feeling that something is wrong in her, but it's not in her, it's just the support that she needs in her breastfeeding practices. So this is one of the example where I am explaining that if the baby is a twin delivery, or a mother has blocked the or difficulty in attaching or latching the baby, then she can go for a cradle or cradle position. And very small babies or the sick babies can be supported with the arms opposite to the breast. So that is a, we can call it as a football hold. Okay, we are holding the baby in our arms and giving. So depending on the situation, the need, we can counsel the mother. So I would again say, if those who have not listened to yesterday's session, do listen and understand how better we can counsel our mothers for their practices. And the last figure, 99%, I would say, whenever we assess a breastfeeding, this is what we see. So we need to correct this position, we need to correct the mother's position, and then we need to correct the child's position. And another myth which is very common and which is very practiced also is that in each feed the baby should be fed from both the breasts. So, well, I had earlier shown in my few slides that there is a fore milk and a hind milk. The milk which is produced initially for the in the during the feed is the fore milk, which is rich in water and lactose, and the milk which is produced in the later part of the feed is the hind milk, which is rich in fat and which satiates or which gives fullness to the baby. So, if the mother is practicing feeding the baby for both the breast in one feed, so basically, the mother is just feeding the fore milk. And I say that if somebody has drank a glass of glucose water or a water, will it fulfill the stomach, or will the child be able to not feel hungry? No, the satiety comes with the fat, with the proteins. So it is important that the mother should breastfeed the baby and empty her breast by at least minimum feeding for from one breast for 15 to 20 minutes. But as I say, again a disclaimer here, it depends on woman to woman. Few women might the child may be able to complete the feed in 15-20 minutes, and for few babies it might take to as long as 45 to 60 minutes. But the key point here is to emphasize is at one feed the mother should feed from only one breast. She should empty the breast, she should feed the fore milk, and she should feed the hind milk. Not feeding the hind milk, again in every 1 to 1.5 hour the child will be hungry, the child will not be able to gain adequate weight, and that will again affect the mother in establishing her successful breastfeeding. So the key point here is, I'm again repeating, please ensure that mother feeds from one breast for minimum 15 to 30 minutes. uh, the most common situation that we see in our today's life is either the baby is fed breast milk, or for initial few days the baby is fed on a formula milk or an animal milk, which is our traditional practices. So the graph here shows the composition or the different milk composition which is there in human, cow, and goat. The cow milk and or the formula milk is basically made from the cow's milk, so we can relate with the cow's milk for infant formula also. And if you see, both the animal milks have high protein because the calf can walk within half an hour of their birth. So they require high protein diet. So their milk is high in protein, whereas our babies are generally in supine position for a long period, maybe few days, few months. So there the requirement is not as high as that of an animal, and it is perfect in mother's milk. So even on day one, every mother can feed their baby with their milk, and we need not have any animal milk or formula milk on day 1 and 2 in the establishment of breastfeeding. The most challenging part is that we should establish breastfeeding on day 2, within day 2 of the child's birth, and it can be taken care if the correct position, correct attachment, and frequently breastfeed the baby, then the establishment can be done. And a point to pointer here is that those babies who are formula fed or are on infants formula milk, they generally, since it is high in protein and high in fat, they feel satiated for a longer period of time, which means the mother might skip the feeds that she is supposed to give. Instead of 2 hour, 1 hour, the baby might be feeling sleepy for say 3 to 4 hours. So that skips the feeding, and that eventually on a later part affects the child's growth. So we need to ensure that the child is fed in the right amount needed for the child's body. It, when we say family support, it is always considered the woman in the house, the mother-in-law, or the sister-in-law to support the mother. But it is always the entire family, the society, who should be there for the mother to support her breastfeeding. Like you can see here in the picture, the man is helping the family in their daily household chores, and at the same time, if the mother needs some support for breastfeeding position, the family members, the male member or the family member, can help the mother, especially in the initial few days, in giving and supporting the mother in correcting the position and attachment, so that the mother can breastfeed it successfully. So the myth related to breastfeeding the baby in a lying position is that if the mother feeds the baby in a lying position, it leads to ear infection. Remember, if we correct the position, as you can see here, the mother is supported with the back support, and here the baby is supported with the mother's hand. Okay, so if the position is correct, baby is in a one line facing towards the mother, and the chin is, which we can't see in the picture, but here if we can see, the mouth is wide open, the lower lips are turned outwards, and the areola part is inside the mother's breast. It leads to the correct attachment, and even in lying position, the baby can breastfeed successfully. This I suggest, and I recommend also many times to my patients, because we want to establish breastfeeding till 2 years of age, and it is not expected that mother will breastfeed the baby in midnight every time, waking up, sit and feed the baby twice, thrice. For initial 6 months, the mother is only with the baby, and can be taken care of. But as and when the child gets older, she has other responsibilities, and with that it is difficult for her to continue night feeding, especially because she can't sit every time during the night and feed, which our mothers many of times do it. But still, we want to establish that, and for that we need to ensure that we recommend that mother can breastfeed in a lying position, but she should check the attachment and check the position of herself and the baby. If it is correct, the baby can be successfully breastfed even in lying position. This is the silent killer, I would say, which is very, very common and unidentified and undiagnosed, is the postpartum depression. Very common in today's, I would say, not even in urban situation, but it is equally prevalent in rural and other parts of the country. So for this, again, we have a session specially dedicated to this. So do listen to our upcoming webinar series and understand what is postpartum depression and why it needs to be tackled, because it is a burning issue in establishing a successful breastfeed. Lastly, I would say, whenever we are counseling as a support group to a lactating mother or a pregnant mother, it is not just the mother. We are counseling the family, their friends, and how better they can emotionally, psychologically, physically support the mother in establishing her breastfeeding practices. Exclusive breastfeeding is not possible if we just have a check questions in the fifth, sixth month, that are you still exclusively breastfeeding your child? Because once the initial 2 days struggle is solved, it is the next, which is the initiation of complementary feeding, which the mother starts in 6 months or maybe before that, because simple understanding is complementary feed needs to be start at 6 months, but at 6 months meaning at the completion of 6 months. So we do need to check a cross check questions like, are you still exclusively breastfeeding the baby in this humid atmosphere? Are you giving water with this? It's a leading question, right? And what would be the response? No, because there is awareness that exclusive breastfeeding should be there for 6 months and water should not be given. So please ask open ended questions. What are you feeding your baby? uh, in a 24-hour, maybe we can ask, or maybe we can say split the question and ask, in daytime how many times you feed your baby, and during nights what do you do? So what do you do means, is she breastfeeding? If yes, how frequently? If not, then what are her concerns and why is she not able to breastfeed the baby during night times? I thank you all for this. Any questions?
Thank you, Dr. Shruti Kantawala, for a very engaging and an informative session. It was a pleasure listening to you. I have received two questions. The very first question is, what if the mother experiences breast engorgement due to the production of breast milk?
Yeah, good question. So, breast engorgement generally happens when the mother is not expressing out enough the complete milk. Then she might face breast engorgement. She can express it out either manually or through a breast pumps and store it for, say, in a room temperature for 5 to 6 hours. And if she is refrigerating it, it can be stored for 2 to 3 days, so 48 hours to 72 hours. But in refrigeration, she needs to label it, and we go with the principle of first in and first out. So if the mother has enough milk production, okay, which is beyond the child's requirement, she can feed the babies in between whenever the mother is not available. Or I would recommend, if the mother has stored the milk, she can donate to the nearest human milk banks that are available, so that the other mothers who are facing the problems can be supported with their help. So the theme says supporting each other and creating a supporting group. So that can be the way we can support each other.
Thank you, ma'am, for throwing some light on this issue. The second question is many a times it becomes difficult to make the family members understand that the colostrum is sufficient enough to meet the baby's requirements. So, what can be done as a lactation counselor? What can we do to
Uh,
make them understand the point?
yeah, again, I will just say what I say to my when I do the counseling. I always ask them, can you measure the leaking tap? Can you measure the amount of water that is uh, leaked? If not, right, so we cannot measure the amount of colostrum that is produced, but we can have a check question like, is the child growing weight adequately? Okay, has the child passed urine, or has the child passed stool in initial 48 hours? If those clinical signs are there, and if the child has passed urine and has passed stool, that means the breast milk or the colostrum is sufficient for the baby, and we did not do anything else.
Thank you, ma'am. Thank you for attending the questions. Like it is always said that it takes a village to take care of a lactating mother as well as to
True.
take care of a growing child. Okay. So thank you, Dr. Kantawala, for your engaging presentation and insightful responses for the questions asked. We appreciate you sharing your time and expertise with us. Before we end today's session, I would like to thank Professor Dr. Anjali Pahad, ma'am, Dean, Faculty of Family and Community Sciences, the Maharaja Sayajirao University of Vadodara, for her due permission and motivation as always. I would also like to thank Professor Dr. Mini Shade, in charge head of Department of Foods and Nutrition, for her constant support and guidance. Professor Vanisha Nambiar, Professor Department of Foods and Nutrition and coordinator of the International Webinar Series, for her support in smooth conduction of the series. Lastly, I would like to thank all the participants for patient hearing. Please stay tuned for our webinar series daily from 12 to 1 p.m. Thank you.